Oh, yeah. Be here early.
I think we have the same dress on. So how did my sense? Well, yeah. Pattern might be slightly. They don't see the floor. Very cute. That's good. They're joining, attending, what's happening.
We're making sure our technology works before we get started. So excuse the dinging, binging and all that stuff.
We should probably X out of that on the left.
Which one?
The one that says recording on, what does that say? Participant has enabled. I can't read that. Okay, there we go. Good, good, good.
Should we guys this one?
There's a. I have one word. I think just I start clicking down.
Natalie, can we chat with the participants? Can they say they can hear and see? Because we're perfect.
All the other pictures. What are you gonna take on? Oh, that. Look at you. We're multi-talented. Yeah. Yes, we can get rid of this. Welcome, welcome, everybody.
Hi.
I think you went that.
They say it's good?
Do you see the picture? Yeah. Sound is good. Sound is good. We are ready to start. We are ready to start. Good morning, good morning. Welcome everybody to our June, if you can believe that, seminar at the library. I cannot believe it's June. Anybody else hot?
Yeah.
Anybody else gonna be gone soon to someplace cool like Colorado or any place fun? Yes, okay, could I go with you? I'll go in your, oh, that's one thing, hard thing about my job is this is my busy time of year. So this is when I'm out there working like a dog. So my name is Cindy Cummings. I'm one of the founders of LT Senior Services. We are a nonprofit. We are a nonprofit and our goal is to help older adults in the Lake Travis School District. We're very specific. And we're just so happy to be able to offer programs such as this seminar. I wanted to tell you a little bit about our seminar coming up in July. So July, we have an amazing speaker who's going to be talking about living with Alzheimer's disease and dementia. Knowledge is power. And our speaker is Tracy King of Care For. So I hope you'll come. She'll be here talking about dementia. In August, we're going to be talking about decluttering your home, one of our most favorite and well-attended seminars. We hope that you come to that also. We have seminars each month. We have the Aging Well Expo that's going to be happening in September. We have 3 speakers for that event. We also will have vendor tables set out with lots of different information about how to live healthy and well. Our whole thing is about living the best life that we can live. So we hope that you will attend that. We're kind of changing up our format a little bit for people who've come in the past. I think you'll like how we're going to set it up. It's going to be different. We'll have breakfast, we'll have lunch, lots of drawings of fun things. So we hope that you will attend. In December, we will be holding the Lakeway Trail of Lights, date to be determined. So what we do is we meet at the activity center. We have hot cocoa and cookies, and then we all head together to the Trail of Lights and we walk that. Some people walk fast, some people walk slow. I'm kind of on the slow end, so hang out with me and we'll do that walk. We also will be having our shred day. So our shred day is, I'm looking on here, I don't see it. It's in September. So typically we have these shred days. The reason why we do them, it's a great fundraiser for us, it's pretty easy. It's easier than selling cookies and lemonade. But it helps older adults when they want to clean out all their paperwork and they're worried about how to get rid of all the papers. We found that the shred day is huge. A lot of people put it on their calendar and they work towards it. We have some people who bring a bag, we have some people who bring a pickup load. So we do not determine how much you bring, and we hope for donations when you come. We have members of the LT Senior Services. There are about 40 of us. We have for-profit and nonprofit. One of our members is Baylor Scott White. They're here today, so they'll talk a little bit later on. But we also have other members, and one of our best members is the library, of course. So here is Morgan to talk about the services that the library offers.
Thank you, Cindy. There's a lot I could talk about right now. I could talk about our tech help. I could talk about live music Friday afternoons in June and July every week at 3 o'clock in the library. I could talk about our home delivery service, but instead I'm going to sell you on our summer reading program. No, it's not only for kids, it's for everybody. Pick up a punch card, borrow one from me or at the front desk. If you read or listen to 5 books throughout the summer, come tell us. Get a punch every time you read a book and then get a coupon for a free book from the bookstore. So we would love your participation. And if you have any library questions, I'll talk your ear off. But thank you, Cindy. Thank you for being here.
Thank you. Thank you, Morgan. Morgan, this is kind of like our activity center in a lot of ways. There are so many activities going on all the time. You could come up here, and if you're bored, there'll be something going on, somebody to talk to. It's just a great place to be. You might have noticed that we have some changes that have been going on. You're receiving communication from a different person right now. I don't know if you've noticed that or not. Miss Natalie Harris, would you come up here, please? Yes. Come on. Come over here in the camera. So she told me where you have to stand for the camera. So Natalie has been instrumental. We're both probably gonna cry. Anyway, she has been instrumental in the success of LT Senior Services. She's not dying. It's okay. She just has a lot on her plate. She has a lot of things going on. I am an active real estate agent. She's my marketing manager, and she works a lot. She works a lot. In addition, she was doing hours for LT Senior Services, and it's too much for one human. So she is retiring, but she's not going far. And we have a little plaque for her.
Oh.
So I didn't have it too big because she's kind of a minimalist, and I knew that. So it basically says Outstanding Service Award recipient Natalie Harris. She has gone way beyond what an employee would do. She has loved this organization. She has worked so hard on making it better, and she's really unhappy with me right now, but I want you all to give her a big round of applause. Let's see if she has any words.
I'm a major introvert, so this is, yeah. I do really love you guys. I love this organization. And I will still see you, so I'm not going away forever. But yeah, it's just been a pleasure. So thank you.
Thank you. Of course, I couldn't tell her about this ahead of time. She wouldn't have shown up. I know her so well. So without further ado, we are going to introduce our speaker for today. Our speaker is Dr. David Murdy, and he has hailed and been here for how many years now? 3 years, 4 years? 6?
6 years.
Oh my gosh, it feels like it was just yesterday. He's an internal medicine physician with Baylor Scott White Health. Dr. Murdy enjoys helping his patients solve complex diagnostic and medical management problems and working with them to get the most out of life. In his spare time, I'm looking at him like, do you have spare time? He enjoys boating, flying, reading, and spending time with his wife and 4 sons. He has been recognized as a top doc for 2023 and 24 by Austin Monthly Magazine, and winners are nominated by their peers as among the best in the region or nation in their medical specialty. He is up at Baylor Scott White. He has helped my mom for years. I've had the pleasure of his wisdom and have loved that. And I know many people in this audience also go to Dr. Murdy. Today he's going to talk about how to get the best value and safest care from your healthcare providers. So without further ado, Dr. Murdy. Okay, and really close to you.
And someone will yell at me if I'm doing the wrong thing, right?
Yes, we'll yell.
Thank you all for coming. I want to commend the library for their reading program. And I have a family story. So, our kids, readers, 4 boys, 21 now to 31. 3 are married. Many of you know that, because you've seen pictures in the office. But the important part is that they participated in the summer reading program. And I'm excited to hear that the older people are encouraged as well. And I encourage you all. But I want to warn you that my wife's last award for winning, our children winning the reading award, was she had to eat chocolate covered bugs.
Ew.
So that's not the award this year, correct?
Correct, not.
Okay,
the
just
word.
check it. I didn't want you to know that you were like signing up at the end of 5 books to win chocolate covered bugs, but it was to great amusement of all the children who were encouraged to read. And in a world where reading is, particularly books, things like you hold in your hand are rare. I think it's something that we as adults need to encourage. Don't believe all the press. Most of you know better about me, but today is a talk that I promised people in the audience based on the men's breakfast that I did earlier. And so a little bit about this is specifically about primary care, but a lot of it is based on how we got to the situation where, you can get a bill that we charge $200 for a blood test, like me, okay? My doctor ordered this blood test, $200, of which 190 of it is contractually discounted and disappears, of which my insurance pays $7 and I pay $3, right? You're going, how on earth can you run a world like that? And how do you navigate it, more importantly, because that's a part of what we're trying to do is to navigate it. Oh. So our purpose today is to help you understand how you can get the best care and to get the most value for your care, and more importantly, the safest care possible. Well, let's see if I can make these. All right, so many of you know, healthcare spending is approaching 20% of our gross national product, $4+ trillion a year. And trying to navigate it is not specifically easy. Today's headlines, and I brought my little briefcase full of them, include newspaper articles from the Wall Street Journal, the New York Times, everything about all of the different ideas to lower costs, or we wish we could somehow get more value for necessary care, close gaps in care, improve access. And there are lots and lots of people who are to blame. So as an example, we have, considerations for hospital and health system mergers. Many systems are very large. Baylor Scott White is the largest not-for-profit healthcare system in Texas and among the largest not-for-profit systems nationwide. Then there are complaints about private equity, going in and buying up physician practices or your dentist practices and then saying, oh, well, what happens with that? Or health insurers, and we all have to deal with health insurers using pharmacy benefit managers, that's what PBM stands for, to avoid the laws that were enacted 12 years ago to try to limit what they could profit in healthcare insurance, what they call medical loss ratios. And I'll be happy to talk a little bit about what all those mean. And obviously drug costs. And the most popular one that I like to talk about is this little sample I have of Ozempic, all right? Where people are sitting there going, this is $1,300 a month? Who pays for this? Well, the reality of it is that the pharmaceutical manufacturers have learned what doctors had to learn, and we'll talk about that history in a second, to sit there and charge unrealistic prices. Somebody might pay for it. One of my patients did this morning on a video call, but she could only afford it for a month. Now, it helped her health a lot. But again, what do you do when these things become unaffordable? Now, the pharmacy benefit manager probably buys it for $400, charges you $300, and charges the health insurer $100. That's how it all works, right? And again, pharmacy benefit manager profits were not included in medical loss ratio. So when you're sitting going, well, how do these companies make out, right? And then I'm not saying they're doing well. None of the people on this list are receiving monopolistic rents. That's part of it. Physicians, nurses, and administrative salaries have gone up. There was an article in the paper yesterday that basically said that nursing salaries from before COVID have gone up 25% or so. And again, nurses are in demand. There are a lot of people who had nursing requirements in the hospital. Our hospital did great during COVID. I think we wanted one of the better success rates with serious COVID around. Our hospital was a referral area for everything in essentially south and west of this region for Baylor Scott and White. And we have some of the preeminent critical care people around that did better than a lot of other places. Right? But those costs have gone up, and we have a lot of people that help us try to see that you get safe and quality care. And those people have multiplied in an effort to try to get that information to insurers who contract for our services to make sure. And we're still in the midst of that right now with Blue Cross Blue Shield. And many of you may have even heard of that. So we're negotiating with them, as Ascension's had to and other organizations have had to try to sit there and say, how do we get enough money so that I can pay those nurses what they're worth, right? Or hire new doctors. And Dr. Sheena Matthews here in the audience, raise your hand. And to help them. That's not easy. The Affordable Care Act is now 12 years old, and many of us know when that came in, we wondered how it was going to affect insurance, and it has changed things to essentially encourage more people to buy insurance. But for many young people, like my younger children, they can't afford it. All right. And again, some of that was how the law was crafted. Again, that's one of those laws that we had to pass to like know what was in it. But again, as it has evolved over the last 12 years, it has not necessarily had all of the benefits that we were hoping for, but neither has any other health reform gone all the way back to Harry Truman in 1948. So don't feel bad about that particular law when we have had multiple previous healthcare efforts, and we're going to talk a little bit about it. There are those who recommend that we should have Medicare for all. I was at a conference a few years ago in my residency program at Brown in Providence, and that was a big topic of discussion. The problem is I came back and talked to my hospital at that time in Wisconsin, where I was practicing then, is that if we had Medicare for all, my hospital would close. Because the reimbursements for Medicare were not enough to keep the lights on in that facility at that time. All right. And again, we've had notable Medicaid expansions in 34 states, I think it is. All right. But there are a number of holdouts. Texas is one of them. Wisconsin's another, by the way, because of how it was going to be funded and what would that do over the long term. So I have bad news. Unfortunately, we have met the enemy in regarding to this cost problem, and he is us. All right. And so how do we become our own worst enemy? So does anybody know how health insurance began in the United States? Okay, so it didn't really ever begin as health insurance. It began with Baylor. Baylor Hospital in Dallas, Texas, was facing during the Depression significant shortfalls in income. As you might imagine, people didn't have money. At that point in time, if you went in the hospital, they gave you a bill and you were expected to pay it, right? And at the same time, the teachers were in a fairly better situation, and a member of the board of both Dallas Independent School District and Baylor Hospital had a brilliant idea. For $1.50 a month, teachers in Dallas were going to be guaranteed hospital coverage. That's Blue Cross. They're nationwide now. That's who we're negotiating with for our plan for our Baylor Scott White system right now. And then Blue Shield, which was the payment of hospital physician, particularly surgical fees, followed thereafter. So again, in some ways, at that point in time, this was prepayment of some unexpected, but some expected, like maternity costs. Do you know what it costs now to have a baby? I have 2 grandchildren coming this summer. $10,000
More.
Any other numbers? This is like a lottery. No one could lose.
Ooh,
$25,000 is the retail price for having a uncomplicated vaginal birth in the United States. All right? Any of you know what it costs you to have a child?
Yeah, I did. It was $200.
Right, right. And again, we've seen bills within our own organization in the 40s for someone who had their gallbladder operated on and taken out several days in the hospital then, because they did it the open approach compared to laparoscopically, like our surgeons here in Lakeway do now. And it was $250 for the entire cost. Anesthesia, surgeon, several days in the hospital, probably 5 at least, and all of its associated care. Right? I don't even want to tell you what a gallbladder operation might cost them. Right? And again, we're back in that situation where you might see a bill that says at the top line $25,000. But if you say, well, what does your hospital, your doctor, your pharmacist, your anesthesiologist see of that? It may be somewhere between 25% and 35%. Right? So that's part of how healthcare got distorted, is that Blue Cross Blue Shield and many other health insurers, I've negotiated when I was in Wisconsin with Cigna and other health insurers as a part of the organization I was involved with then. And they would say, all right, you tell me what your prices are, and then you tell me what your discount is. What is the best discount you can give me? And we'll send you patients your way. All right? So imagine if you're, and many of you have been in small businesses or even large businesses, where you're dealing essentially with a large client. And then you say, okay, well, you're a really large client, so we are going to give you a great discount. All right, because we want more of your business. All right, so that's how you end up seeing prices for having a child, uncomplicated vaginal delivery, $25,000, of which probably, I can't exactly tell you the numbers, most healthcare organizations, the GYNs, the nurses, the NICU, whatever was involved, might be exceedingly happy to get $8,000. And you might say, that is still a lot of money. When you think about that person may only now, under current guidelines, be in the hospital a day or two, compared to when many of you may have had children, and it may have been many more days than that. All right, so that's one component. So think about how this works to distort the market, all right, and puts you as a patient at a disadvantage trying to assess value of care. I wish I had a solution to this. I promised the men's club, I don't. Okay, Henry Kaiser built ships in World War II, Liberty ships in Southern California, but first he built Hoover Dam. And knowing where that was at the time, his workers needed injury and health care. So what did he do? He brought, in essence, prepaid medical care that he paid for because they were his employees and dependents to the site of building Hoover Dam, which was then in the middle of the Nevada desert, now near Las Vegas. Las Vegas was like an intersection at that point in time. Okay, and so that was again a part of prepaid healthcare. So we've had a lot of options for prepaid healthcare. I did my dissertation at the University of Chicago on the development of a healthcare plan paid for by John Deere and Company, because they were looking at healthcare costs exceeding what they spent on steel. And of course, Lee Iacocca said the same thing about Chrysler, that they spent more money on healthcare than they bought for principal materials to make a car. Right? And as corporations have seen that, that developed into HMOs, prominent in Minneapolis, St. Paul area, but now across the world. That was very popular in the 80s and 90s, and it's kind of lost favor. During World War II, another distortion in the market happened that we're all aware of. There were wage controls during World War II, right? Many of you may have even been a part of knowing that, or your family being a part of it. But what was not included in those wage controls? Fringe benefits, right? So a company might not be able to offer an employee to attract people to build planes or whatever happened to be tanks, make shells, whatever was needed for the war effort and salary, but they could offer health insurance or other similar fringe benefits. And that became a very important part of collective bargaining in a community like I practiced for in Wisconsin for 30 years with General Motors. They have very generous healthcare benefits. And initially, they were very modest in cost. But over time, they became more and more expensive. And now when you look at general employees in a general system, and I'll use our own example. What do you think it costs Baylor Scott White to provide family coverage for an old duffer like me? My guess? Pick numbers. You guys have been doing pretty good, actually. $26,000 a year, of which they charge us about a third. And obviously they have tiers for lower immersed employees so that they pay less. But still, even for a standard employee, for a nurse, a clerk that you greet at the front door, it's a fairly significant part of salaries. And we've seen in the last probably 20, 30 years, where a lot of what could have been salary growth that could have helped people pay for mortgages or buy cars, all that get diverted to health benefits. And I'm not here to tell you that health benefits are bad, but they, like anything else, have to be weighed compared to adequate housing or appropriate clothing or sending kids to school or anything else, right? So part of what also made it harder was that 12 years ago, catastrophic health insurance, the kind of stuff that you could buy from Mutual of Omaha, was eliminated from the marketplace. So you can't buy it anymore, all right? You were forced into the exchanges or your own private insurance through an employer, as an example, and now through an association if any of you belong to an association. So all these in some ways have distorted the market. So is there a quick fix? No. There have been people for the last 70 years saying how to fix this. And again, part of it is that you want to guess what the benefit to the citizens of the tax deductibility, think of it that way, of your health insurances. What we all have to pay if we were paying for healthcare with after-tax dollars. $300 billion. Right? That's a lot of taxes that would come to people who are also, so it's again, one of these trade-offs. But how do you essentially reverse this? You have to do it a little bit at a time, and there's a lot of incremental approaches out there, but none of them are very easy to go. Right, so how do you get the best value, the safest care? First of all, and my wife reminded me that exercise should have been number one. So forgive me for not making that number one. Right, but a lot of it is basic stuff. If you eat right, you keep your weight under control, you sleep enough nightly, you avoid too much alcohol. And I had a case where someone had been injured and their alcohol level was a lot higher than they estimated when they got it checked in the emergency room. And I said, we have to be more careful as we get older with every drug, including the ones I prescribe for you, but particularly things like alcohol and potentially some of our supplements, because they can have adverse effects that we are not aware of because we may not metabolize them. We may have more of an effect, meaning a side effect, and alcohol is principle. And in this community, unfortunately, not so much amongst older people, but among middle-aged people, it is an amazing cause of death in our community. We have heart attacks in our hospital. We have, respiratory failure and pneumonia. Thankfully, right now, we don't see much COVID in the hospital, thankfully. But if you sit there and say, if there's a 40 or 50-year-old in our intensive care unit, it's not uncommon that they're for alcohol, and often they die. And think about how many years of life are lost. Right, so again, staying exercising on a daily basis is the most simple predictor. When I ask you, how well are you doing? And do I need to ask you any of those other geriatric assessment questions? Can you get up out of bed in the morning by yourself, or do you need help? Can you get to the bathroom on your own, or do you need an assistive device? Can you wash your face or your bottom on your own? Can you feed yourself? Those are activities of daily living. You have to do all those to be able to be in this room today, right? But if I ask you, are you still exercising? Or are you traveling more than 50 miles away from home? I don't have to ask you any of those other questions because you've passed your geriatric assessment. So you think I'm just sitting there blindly typing my notes so I can give you an after visit summary? No, I'm asking you important criteria. And when you can't do those things, we need to know why, right? We want you to avoid injury. The person who was injured today fell off a ladder. People my age and older don't need to be on ladders anymore, right? Unless they have rails. And I have one that does. Okay, my children got messages. Okay, and be careful of our balance. If you want to know what is the best predictor, I don't have to demonstrate this where I'm not in the screen here, so forgive me for a second. Is if you can sit here and stand on one foot, not holding on to anything, for 7 seconds. That predicts mortality more than anything else. So again, a lot of those are simple exercises. Even if I have to start off with holding on a counter with my fingertips, and I can work on core strength. Can I improve my life expectancy? Yes. What does that cost you guys? Nothing. You're standing there anyway, getting a coffee or washing your hands. Right. Second, choose insurance, if it's up to you to choose, that fits your locale and your needs. I've been proud to be a part of an organization where we have been able to bring better care locally, I hope, in a way that allows people to not have to take their lives in their hand on 620 or on 71 going downtown or far away. Because at some point or other, if you're on those roads, you're having your heart tested every day. And I don't have to, in some ways, know if you're not getting anxious in those things, then I have to worry a little bit about your spatial awareness. And most important, and again, this is a biased answer, is use and choose a primary care physician and their care team. I'm not here by myself anymore. I was never by myself. We've always had other doctors in the practice. But now I have 2 nurse practitioners. I trained them, right? They are very good, right? They routinely astound me on how perceptive they are, how, how much empathy they show, how much connection or rapport they have. And again, they have better quality ratings than I do. And I'm very proud of that, all right? They're probably a little more on time than I do, all right? That can help guide you through your care journey. Because without that, you're at a significant disadvantage. Primary care people are internists like me, geriatricians, family medicine specialists, and obviously for the younger people in the audience, some are OB/GYNs and obviously some are pediatricians. They are your gateway. They should always be your first stop. They might not be the only stop you make, but they can be your first stop. Not the emergency room, where a lot of unnecessary care happens, or even, the hospital, and maybe not an urgent care setting, or a specialist. Now, there's some times when that referral may be appropriate. But certainly I encourage people to avoid the Googles of the world. I don't have to my or coming forward, artificial intelligence doc sites that tell you, okay, well, we can take care of everything. Because why? Your primary care doctor is the only research proven source of care that can lower your costs and improve your life expectancy. Okay? My cardiologist can't do that. My invasive radiologist can't do that. My oncologist can't do that, but primary care can. And we need to work with you to make sure that your questions are answered, that you feel that you know what you're doing. And I have an example for you. So you guys had talked earlier about an example of gastroesophageal reflux disease. So what is it? Gastroesophageal reflux disease is excessive acid traveling from your stomach through your lower esophageal sphincter, which is a muscle that's supposed to keep it in your stomach where it helps you digest carbohydrates and hopefully not yourself, because there's a lining in your stomach made out of prostaglandins, those same prostaglandins that can be broken down by too much ibuprofen or Aleve or similar medicines. So be careful, right? But if that stomach acid goes up into your esophagus, you can have symptoms of gastroesophageal reflux disease. Does anybody know what some of those symptoms are? Yes, ma'am.
Coughing.
Now you're stealing my thunder.
Yeah.
As an example, heartburn is a classic example. But what she is exactly right is cough. And I have a story to tell you, again, about cost and primary care. So one of my wife had been a participant in a major cardiac rehab program in Peoria, Illinois, when she was in a training before she set up cardiac rehab programs in other parts of the country. And one of her friends that had befriended her when she was a poor intern making less than $1,000 a month with hardly any food, living in a tenement with somebody she didn't even know. They took her out to dinner, befriended her. These people were coming through our community in southern Wisconsin on their way to where? The Mayo Clinic, because she had a cough, right? And they couldn't figure out what's wrong with her. Her x-ray's normal. They had nothing on physical findings. Her labs were all normal. And so she's sitting down at dinner, and we took them to dinner. And I said, have you taken any antacid medicine? No, I don't have any heartburn. She did not have heartburn. And she hadn't thought about anything like that. She had not had, thankfully, any serious red flag symptoms like bleeding or coughing, vomiting, blood, or anything bad. And I said, well, have a good time at Mayo. And I think the reality of it is that this is probably GERD causing it. And with an antacid tablet, at that time it was called Prilosec. It was the first purple pill, right? This is how long ago it was. Her cough went away. And she wrote back to my wife and said, how come I just didn't stay in Janesville and come home? Because I didn't need to go to the Mayo Clinic, right? And again, that can be hard to distinguish between potential cardiac causes of pain, is the same fibers that tell your body if you're in pain around your heart circle and surround your esophagus. So it can be hard to tell. And for a lot of people who have pain and spasm of their esophagus, even if they take a friend's nitroglycerin under their tongue, they say, oh, that made it go away. It must be my heart. No, it may just be that spasm from the lower esophageal sphincter made it go away, right? So again, a lot of times what we need to think about in primary care is to ask the story and elicit information from you, and at some time teach a bit about what might be going on. Make sure we're not missing any evil problems and recommend a simple solution, knowing that if it doesn't work, we can always go to the next study, the next test, right? That's not an answer that you can get in an emergency room, but that's an answer you can get in a primary care setting. That's how primary care can lower your costs and make you more confident, assuming we answer all your questions, and make sure that you feel satisfied with that. That's why this makes a simple thing. So did I cover GERD for y'all?
Yes.
Okay. So remember, there's also downsides. People taking proton pump inhibitors like omeprazole, and there are others, there's now many others, all right, can have long-term adverse effects that have been associated with dementia. So there are other things that can be done as well, weight loss, other kinds of things. And in rare cases, we have specialists and GI specialists who can measure the actual acid in your esophagus and determine if other procedures, some are surgical, are appropriate for you, right? But that's not where you want to start. Sometimes you can start with Tums and Maalox and go, even though I don't have every symptom, is it worth a try? Because again, even if you had something as evil, God forbid, as some sort of, GI cancer in your stomach, us giving you an empiric trial for something that is 100 or 1,000 times more common will make no difference in your long-term care as long as you follow up. And if what we give you doesn't work, you complain to me. How many of you I told you in this audience is if this doesn't work, you're supposed to complain to me. You're supposed to be raising your hands then. Okay, right. So make sure that, again, a lot of problems is that people will get care and then they fail to follow up. I don't need to have you come back to tell me you're well, but I do want to know through our portal or through our phone lines. And I know it's sometimes hard to get through to us, and we have options for that, right? So you know how to get back to us to make sure that we give you the care that you need. So we are committed to building more comprehensive care for adults in Lakeway, but also in the surrounding Lake Travis area. We have a clinic in Bee Cave. We have one in West Hills. We have one up in River Place. They're all doing marvelous. We have actually an urgent care site that we're hoping to open here in this region within the next year or so, right? To provide off-time care that will coordinate with our electronic medical record where we can help do your follow-up. We're adding more physicians. Dr. Matthews in the audience. Dr. Patel will be here in a month or so, as well as another one coming less than a year from now. All right. And yes, we've had Dr. DeWitt's retired. I saw him the other day. He looked really tan, really relaxed. I told him to get out of there before he started to make the muss. And we are happy to be a part of an organization that's had 40 years of providing medical care in our community. And to carry on with that tradition with Dr. Reddy and others who've been here a long time as well. We're also adding mid-levels, nurse practitioners and physician assistants to our team. And so as an example, on any given day, if I'm not there in the office, you might see Dr. Matthew, you might see one of the mid-levels, right? I want you to think of them as me. And if that's, working to your, you'll work on it. If there's a problem, I'm the backup. Like I tell them, I train them. If they don't know something, it's my fault, right? And again, they collaborate with me every day on what should happen, what should be done. We're adding more specialty care. We have 2 new specialty neurologists at our hospital. We're getting a new nephrologist in a few weeks. And, we're adding a new cardiologist so that we have better access to those things. And we are already bringing some of those advanced testing into our clinic for heart rhythm monitoring, probably even for advanced cardiac testing. And we're using more of that technology, not only in our hospital, but also our local Austin hospital, right? And we're working to develop stronger hospitalist primary care relations so that we follow your hospitalization and we can help make sure that if there's additional information we can provide to the hospitals, they know it, as well as we're trying to make sure that we continue to expand our care out into assisted living facilities and into the skilled nursing facilities so that there's a tight loop. We already have that loop with our inpatient rehabilitation hospital here in town, and we're hoping to do more of that. And I wanted to remind you that, if you're looking for additional services, please tell us what we should be advocating for. We've been certainly advocating for advanced cancer therapy here. That's likely to come in the next few years as we, have obviously the mass to do that. Our centers in Austin and in Marble Falls are very busy right now. So if you need care, come see us. Right, so here's where we're at. Here's the clinic's phone number, right? Obviously, use the portal. That's obviously answered normally that day, right? And we have staff that answer it even if I'm not there, right? And we also have a 24/7 virtual care line that can handle minor problems. You're not sure what this is, do you need the care? We obviously have 24/7 physician advisory nurses or patient advisory nurses who can give you ideas, and they're now more oriented towards getting that information back to us so that we can coordinate and get people in like we did today, where someone got a message during the night, we'll have that patient seen today. That's all I really want to talk about. I'm perfectly happy to answer questions, and Dr. Matthews can too.
All right.
Yes.
Thank you so much. We appreciate it. I'm gonna. So I'll watch you if you raise your hand and if you will talk directly into the microphone. We have a lot of people online who are also listening to this.
I really appreciate the portal that Baylor Scott White has set up. We can get answers a lot quicker than normal. So I appreciate that. I am concerned, however, when I call the normal number.
Yeah, that one.
That is one major headache trying to get through You gotta sit there for 20 minutes to listen to somebody talk to you about the hospital. And I have,
I at least got them to stop asking you COVID questions
yeah,
for a visit 6 months ahead.
well,
Oh, gosh.
that still needs some help, so, but I appreciate everything you said today. The portal works great, but the phone system needs some.
Well, for everybody, who's following with my team, obviously, we have a nurse line that actually gets answered now. Obviously, if she's away from her desk, you leave a voice message and Teresa will get back to you. And we're working to roll out, as we have enough staff in the clinic, that every provider has their own line for, I need an answer today for a medical question. Not everybody's comfortable with the portal, right? And that's okay. We're here to meet you wherever you're at, as well as making sure that, our front desk is as helpful and cordial as possibility and getting you options for appointments wherever it may be most convenient for you.
I commend your office, though, they do a good job.
And we need more of them, so just, we appreciate your support for that. Other questions?
Actually, close.
I'm talking right now. His question was my question, but I also have a number 2 question.
Good.
There's not enough time to see the doctors.
Tell me more.
We can wait 45 minutes to an hour to get an appointment, or in the waiting room to get to our appointment. Then we have 15 minutes.
Well, all my appointments are 30 minutes long. So if I gave you 15 minutes, I shortchange you.
No, but you wasn't you, sorry.
All right, but the point is that, I learned long ago. I took over a practice now, almost 40 years ago in Wisconsin, of a young man who said, well, he wasn't young, then he was retiring and we were building him a clinic of his own. And he said, well, whatever people tell you last is sometimes the most important thing. And sometimes you just have to sit right back down, get your hand off the doorknob and talk about it. And the classic, of course, is the guy who comes in, his wife said, you better go talk to the doctor about your chest pain. He talks to me about his fishing trip and his blood pressure and how his labs turned out. And then says, oh, by the way, my wife said I needed to talk to you about chest pain. Okay, so one of the things he told me, and to my probably disadvantage of my quality scores, is that I'm not gonna walk away from that most important thing at the end of the visit. And that doesn't necessarily mean I run on time. And I've had partners who run exactly on time, and they'll leave a prescription on the pad and walk out and hope that you don't have any more questions so they can be on time for the next person. And I appreciate timeliness. Don't think I'm trying to not pay attention to that. But what I really want is people to get their questions answered and feel that they got the time they needed so that they could walk out confident in what the recommendation was for therapy or an appropriate test or referral. So that when they go see that referral specialist or interact with that test, they know what is going to come from it and the good that's going to make them feel better, live longer, or whatever. And I hate to tell you that that doesn't always run on the clock. I mean,
You'll understand.
we often have people, new patients in particular, to come to the practice who have 13 active medical problems and take more than a dozen medications, some of which interact with one another. And sometimes I tell my staff, is the first thing you should assume is that the interaction of medicines that we prescribe is a problem and that we need to be cautious. Now, that doesn't mean that we don't take care of high-risk problems with medications. We do. Heart failure, we help with the oncological cancer care and pain control and all of that. But I hate to tell you this, but even sometimes 30 minutes is not long enough. Do I have time for a story?
Yes.
Okay, so a long time ago, I had a nurse who was involved in setting up our Coumadin anticoagulation clinic. She involved herself in setting up our diabetes clinic in Wisconsin, and we were the first organization in that part of the area that used insulin pumps. So she pioneered all that, as well as helping me at that time in a comprehensive weight management program, and she was excellent at that. And so she was asking me to see her parents for medical problems and complained to me bitterly on the Fridays that she did help me in the office as my office nurse, that I was always behind, and I am. So she was right. I'm not saying she was wrong. So I had a visit with her father, and we started at 11:30. It was my last appointment in the morning. Okay, we walked out of the appointment 90 minutes later at 1 o'clock. Of course, I had a 1 o'clock patient too. And I said to her, what part of that 90 minutes was wasted? She said, none of it. And I hope that at least you feel, if you're behind, that the time I spend with you is the time you need. And that I don't shortchange any of you. If I do, I'm sincerely sorry about that. But the point is that doctoring care doesn't always run on our schedules. And we have to essentially realize that we're in a human business. And we've all been in situations where that's not easy to do. But we're trying. So thank you for your comments and we'll work hard. Sir. I'm sorry.
I'm just curious, primary care and
Very close.
patient,
Very close.
primary care and a patient is a team. And if I don't have a primary care, what will be the most important thing for process
We
of
get it primary care.
good,
We'll sign you up right now.
good match?
Well, and again, that's important, is to have the right personality, the right background, right interests. You know, we have doctors who have different interests, different specialties of their own within, you know, internal medicine or family medicine. And we're happy to help you match up with who you feel most comfortable with. That you
How I
can,
start?
you'll talk to one of us, and I'll talk to Dr. Matthew in a minute. And she'll give you some guidance on who would be an appropriate within the region, wherever is closest and most appropriate for you to seek care.
Thank you.
And then this young man here.
Just to follow up on the previous question about waiting time for
Sure.
scheduled appointment.
Sir,
One suggestion I would make is that you make an attempt to keep the patients informed when there's excessive waiting time. Because I found that many
Very right.
times there's no information coming back as to the fact that you've kept waiting or even an estimate as to how long you can be kept waiting. Just a suggestion.
it is an absolutely appropriate suggestion, and what we try to do is to give people information as they check in. Right? Obviously, if there are significant delays, we actually call people and tell them. Obviously, the other component of it is that our front desk staff can keep people updated if there is a delay. And again, sometimes we're working with fill-in staff and they're not always as good at or as comfortable with that. But that is our plan. So that's what we're trying to do to make sure that that happens. And obviously, we have people who have to go pick up their kids or things, and we're happy to reschedule them. But a rule in my practice, knowing the traffic situation and the problems in getting around, is that if my patients get to be late, if I get to be late, they get to be late. Because that happens. There's car accidents. We seem to be at a juncture by where the clinic is of a major set of accidents associated perhaps with the high school. I don't know that for sure, but I just know that a lot of times traffic can be snarled. All right, and it is no reflection on any of you for trying to get your appointment on time or frankly early if something happens and you're out of the way. And our goal is to make sure that we accommodate you because we know that you've obviously had to take time to come and we appreciate and realize that your time is valuable too.
Understood.
Okay, anybody else have any questions? Right now, we're handing out a questionnaire. We really do look for your feedback. It helps us to prepare for future events. It kind of gives us an idea of how this event went. So if you would just take a couple minutes and fill that out. You can stick it over by the table on your way out. Are there any other questions for Dr. Murdy?
Thank you for coming and having me here.
Oh, thank you so much.
Thank you.
All right, we'll see you next month. And also, we're still working on our emergency preparedness kits. We have run out of funding. We've had a ton of people give us money, but we're out of money. So we're looking for new funding. So if you hear of any church or any organization that might have some money for us that we could apply for a grant for the contents of the kits, we would greatly appreciate it. Thank you again for coming and see you next month.
One for each.
Dr. Murdy. Really appreciate you coming.